Hi everyone, Dr. Becca Knackstedt. Let's talk about a hemoglobin A1C, why it is a lab test that you should always have before surgery, and how it helps with our clinical decision making. Your hemoglobin A1C gives a number that is an indicator of what your average blood glucose has been over the past 3 months or so. And why that's more beneficial than just a random blood glucose level is that your glucose during the day and during the night fluctuates so rapidly depending on what you ate, what you're doing, if you're sleeping, if you're awake, whereas your hemoglobin A1C kind of averages all those numbers together and gives us a number. This is actually how we diagnose diabetes. If your hemoglobin A1C is 7 or higher, you're diabetic. If it's 6.5 to 7, you're considered pre-diabetic. So that's one reason we want to know your A1C, knowing what your average sugars has been, are you diabetic or pre-diabetic? But interestingly, it's also been shown to correlate with outcomes after surgery. I'm a plastic surgeon. I do a lot of breast reconstruction, and our literature has really demonstrated that if your A1C is higher than 6.5 or 7, you have an increased rate of complications. And why is this? We've talked before about how sugar negatively impacts healing. So you can imagine if your average sugar over those 3 months is higher than 6.5 or 7, it's probably too high to help healing. So if you have an upcoming surgery, ask your surgeon to get your A1C. Not only would help predict your outcomes after surgery, but can help inform you as to whether or not you need to consider some lifestyle changes to be the healthiest you.